So good morning class. I'll be discussing to you our second module, which is distress of infant. So when we are talking about distress of infant, it says that or the term distress meaning it is a state of feeling of anxiety or extreme anxiety, extreme pain, or suffering, illness, disease. So that is what we call distress. So today, we will be talking about different illnesses wherein nagiging distressful ito sa mga bata or sa mga babies. So when we are talking about babies, it is already infant. Actually, it is 0 to 1 year old. Okay? So fever develops when the body's temperature rises significantly above normal. So when there is fever meaning when the temperature of the baby is above normal. So it is necessary that you need to know what is the normal temperature. So the normal temperature of a baby is 35.5 degrees centigrade to 37.5 degrees centigrade. So above 37.5, that is already considered as a fever. Okay, what are the other terms for fever? So the other term for fever is pyrexia. So that is another term for fever, pyrexia or febrile. So pag sinabi nila doon or nagsulat kayo ng mga caregivers notes or assessment notes na pinapasulat sa hospital, if may nabasa kayong febrile, meaning that is already or the baby is in the state of fever or pyrexia. Kaya nga if you see the tempra, yung gamot na pampababa ng temperature, nakalagay doon antipyretics, meaning nakakagamot siya ng fever. So this usually happens when the body is fighting for infection. So one of the main characteristic or main signs and symptoms of having an infection is fever, because it just signifies that the body is fighting the microorganism that is being entered or that is being proliferated inside the body. So it is caused by the increase of white blood cells in the body, because white blood cells are considered as the soldiers in the body. So itong mga white blood cells na ito, sila yung lumalaban sa infection or sa mga microorganism na nakapasok sa katawan ng isang tao. So saan natin makikita itong mga white blood cells? These white blood cells are being produced in the different parts of the body. Particularly if you will to see these features, okay? So these features, dito, tonsils. Ang isa sa mga function ng tonsils ay nagpo-produce siya ng mga white blood cells, okay? Aside from that, sa thymus, okay? It is located just beneath the sternum. Ditoy parte, if you will pag inobserve mo or pinalpate mo or kinarawam dito, ito nga parte ti bagim, ada makita nga tulang dito or ada mariknam at tulang dito, ay that is what we call the sternum. Okay? Just ababa na deta, makikita natin yung tinatawag natin na thymus. Aside from that is the spleen, the Peyer's patches, as well as the different appendix also. Appendix also produces white blood cells. So, ang main function ng appendix natin is for immune system. And the different lymph nodes. Okay, saan natin makikita itong mga lymph nodes na ito? Sa kilikili, meron tayo sa kilikili, meron din tayo sa mga sa singit. Kaya nga pag, 'di ba, pag meron tayong mga sugat, biglang agsalsalamagi tayo. Kasi nga that part of the body is activated for the production of white blood cells. Okay? If the baby is hot or appears restless or irritable, take his temperature immediately. No, agibit-ibit di ubing, tapos ayaw niyang kumain, hindi siya makatulog, or either tulog yung bata, palaging tulog yung bata, take his temperature. Because the baby is probably suffering from a distress or a fever. So, okay, so I'll be discussing to you the different types of fever. So, first type of fever is continuous fever. So, the continuous fever is above normal throughout the day with fluctuation less than 1 degrees centigrade. So, meaning, yung bata, pag nilagnat, if you take the temperature of the baby at 8 o'clock a.m., the temperature is 38. So, that is already fever, isn't it? So, then, alas 10, you take again the temperature of the baby. So, ang lumabas is 37.9. That is still a fever, isn't it? So, pag mas mababa daw, mas hindi lower than, ang sabi niya, lower than 1 degrees centigrade yung pagbaba, pero meron pa rin siyang fever, that is considered as continuous fever. Okay? Next is remittent fever. So, the remittent fever is above normal throughout the day with fluctuation higher than 1 degrees Celsius, okay, or centigrade. Okay, ang sabi naman niya dito, maghapon or 24 hours nilalagnat yung bata, pero bumababa yung if there is a fluctuation, meaning there is a drop of the temperature, but more than 1 degrees centigrade. Okay, for example, 39 degrees centigrade yung temperature ng bata, then you take at 8 a.m. is 39. Tapos, kinuha mo siya ulit ng 12 noon. Ang nakuha mo is 37.9. That is 1.1 degrees centigrade fluctuation. That is considered as a remittent fever. Okay? Next is intermittent fever. So, intermittent fever touches normal during the day. So, sabi niya, kanina, dun sa continuous and remittent, hindi siya, it doesn't touch the normal temperature. But now, in intermittent fever, it touches the normal temperature. For example, 8 o'clock, 39. Pagdating ng 12, 37.5. There is a fluctuation, but going to normal temperature. Then, pagdating ng alas 4, nilagnat ulit. 38.7 or 38 degrees centigrade. That is again fever. Then, kinuha mo ng alas 8, bumaba ulit. That is what we call intermittent fever. Ito yung sinasawag natin na on and off fever. The third or the fourth one is relapsing fever. Okay, the last type of fever. Okay? So, relapsing fever is short febrile episode between days of normal temperature. Okay? Short febrile episode between days of normal temperature. Meaning, ngayong hapon na, ngayong Monday, nilagnat. Tuesday, hindi. Wednesday, nilagnat ulit. Okay? Usually, yan, nakikita yan sa mga tinatawag natin na typhoid fever. Tatako ma'am, nag-rigor, tapos biglang kinabukasan, okay na naman yung bata. Then, the following day, hindi na naman siya okay kasi nilalagnat na naman. That is what we call relapsing fever. Okay? So, later on, I'll be giving your activity with regards to the different types of fever. So you can see in your module, there are 3 columns. So the first column, the first column is the symptoms, the second is the possible cause, and the third is the action needed. Okay? So let's talk about the first one. Okay? So sabi niya doon sa symptoms, is your child under 6 months or over 6 months? So sabi niya, pag mas older or the baby is 6 months and older and there is a rash, okay? Nilagnat yung bata. Yes, fever in babies younger than 6 months is unusual. Okay, so sabi niya, pag older, younger yung bata na 6 months, that is already a serious illness. But if that is older, that is just probably a common fever. But if it is younger, that is a serious illness. So what will you do? What is the treatment? So urgently call the doctor. Okay? Call the doctor while bringing down the temperature. Later on, I'll be discussing to you how to properly bring down the temperature of the baby. Next, does your baby cry and pull at one ear and wake up screaming? So, nagising yung bata, nakitam, na-feel mo or na-ritnam na mainit. Then when you take the temperature, it is above normal. And the baby is pulling his or her ear. Then, umiiyak. Okay? Agib-ibit-jubing. So, the possible cause of that is inflammation of the middle ear or what we call otitis media. Okay? So, otitis media. Okay? So, what is the treatment? Get medical advice within 24 hours. So, napaka-importante. Ay, agduyek lang. Hindi po normal na nagkakaroon ng inflammation of the middle ear ang isang bata. Because you should know that there is a connection between the ear and the brain. Okay? So, if there is an inflammation in the ear, it might probably cause damage in the brain. Especially if that is caused by a bacteria, there is a possibility that the bacteria can cross the blood-brain barrier. May cause now further complications that will lead to brain damage doon sa bata. And self-help, bring down the temperature and relieve earache. Okay? If your baby's breathing rate is normal, does he have a cough or runny nose? Sabi niya dito, yung bata ay nilalagnat pero meron siyang sipon. Okay? Or probably abnormal yung breathing pattern or the breathing rate ng bata because the normal breathing rate of a baby is 30 to 60 breaths per minute. So, when you check the breathing pattern, it is above 60 breaths per minute. Hingal na hingal or hinahabol ng bata yung paghinga niya. So, what are the possible causes? Okay? Pag meron siyang, there is a sipon, that is probably a common cold or either an influenza. Okay? Or if there is a rash, that is measles. Okay? So if your child makes an improvement within 48 hours, then good. But if it develops breathing difficulty or breathing problem, or a rash appear, pag may mga rashes, call the doctor immediately. Okay? Next, is your baby's breathing rate faster than normal? So if the breathing is above 60 breaths per minute, that is probably pneumonia, or what we call the inflammation of the lungs, or bronchiolitis, or the inflammation of the bronchioles. Okay? So I'll show to you the picture of a lung. Okay? This is a lung, or the lungs. Okay? There are two lungs in our body, the left and the right. Okay? The lungs have 5 lobes. Okay? The left lung consists of 3 lobes. Okay? So 1, 2, and 3. While the right one consists only of 2 lobes. Okay? There is a connection between the lungs and the heart. Okay? So, if you have problem with lungs, it is very important to address or to call the doctor, magpa-check up agad-agad sa doctor, because it might be cause further complication to the heart. Okay? Sir, if there is an inflammation of this hole, the lungs, okay, that is what we call pneumonia. But if there is only inflammation in this part of the lungs, ito makikita natin na stem-like or the branches of the lungs. The branches, ito yung mga branch na nakikita ninyo, these are what we call bronchioles. Okay? The bronchioles, if there is inflammation here, then that is what we call bronchiolitis. Okay? Okay, bronchiolitis. Dito, this is what we call the bronchioles. Okay, ito. Okay, ito yung bronchioles na sinasabi ko. Okay? Ito siya. Pag maliliit siya, ganyan. Pero pag pinalaki natin, it looks like this. Okay? So, if there is inflammation to that part, that is what we call bronchiolitis. Okay? So, what will we do? As what I have said, it will affect the heart, so urgently call the doctor. Okay? Next is, does your baby suffers from vomiting with diarrhea, abnormal drowsiness, or unusual irritability? So, agsarsarwa and fever. There is a fever ng bata. Then, accompanied by vomiting, agsarwa. That is the medical term for agsarwa. Vomiting and diarrhea. But actually, it's not diarrhea. It's diarrhea. Okay? It's diarrhea. Abnormal drowsiness or unusual irritability. Okay? That is probably caused by Roseola infantum or meningitis. Okay? So, later on, I'll be giving you exercises or activity regarding Roseola infantum and meningitis. Okay? So, what will we do? What you will do as a caregiver, you need to urgently call the doctor. Okay? Because that is a serious illness. Next is your baby vomiting with diarrhea? Okay, is your baby vomiting with diarrhea? Agsarwa, agtaki, aggurigurpay. That is, the cause of that is gastroenteritis. Okay? Okay, gastroenteritis. Meaning, there is meron nakain yung bata. May nakapasok na microorganism doon sa tiyan ng bata, causing now inflammation of the lower gastric. Okay? What will we do? Get medical advice within 24 hours. Kasi nga, nakakatakot because there is a possibility that the baby will be suffering from what? Dehydration. Nakakatakot yon. Next, is your baby wearing a lot of clothing? Or is the room very warm? Nakapudpudot di kwarto. Okay? Intake mo di temperature di ubing 37.8 or 37.9. Ala, gurigor ko na. But, nakatadumit kiin pa suot mo gamin. Okay? Nakatadumit balot-balot mo doon sa bata, pinag-jacket mo. Kit alam mo na nakapudpudot. Iti panawin. Okay? Tapos, nilagyan mo pa ng baby blanket. Tapos nakabuniti. Ang dami-dami mong nilagay. So, probably, and the room is very warm. Nakapudpudot yung kwarto. So, your baby may have become overheated. So, what will you do as a caregiver? If you think overheating might be the problem, remove some of the clothes of the baby and make something that reduces the temperature of the room. Okay? Is your baby reluctant to eat solid food? Ayaw niyang kumain ng solid food. So, there is probably a throat infection such as tonsillitis or the inflammation of the tonsil, or a mouth which is a mouth infection such as gingivostomatitis. Gingivo meaning gingivostomatitis is inflammation of the mouth. Okay? So, what will we do? Okay? If no improvement in 48 hours, call the doctor. Self-help, relieving a sore throat, and bringing down the temperature. So, how to relieve the sore throat? Okay? How to relieve the sore throat? Pag sa tayong mga matatanda, kumain lang tayo ng chips, or ice chips, para at least ma-relievan. But sa mga bata, hindi po pwede yun. Okay? So, let's talk about bringing down a temperature. Okay? Bringing down a temperature. So, when you bring down the infant's temperature, he starts to feel less irritable and more comfortable. If your child is between 3 months to 3 years of age, you are also reducing the chances of convulsion. Okay? So, nakakatakot yan. Pag nag-convulsion yung bata, because it may, pag nag-seizure, seizure is the epileptic attack. Yun yung sinasabi ninyo. That is what we call seizures. So, the following measures are for a child of any age. So, first, remove almost all your child's clothing. If he is lying in bed, take away any sheets and blanket. Okay? Cool your child down either with a sponge dipped in lukewarm water or in a lukewarm bath. Okay? Ang mga ikabkabil iti nalami is nga danom. Avoid cold water as this can raise the infant core temperature. So, have you tried going to a falls or sa mga spring where napakalamig? Then pag umakyat ka na, okay, or after a few hours na umakyat ka na, biglang mag-iinit yung katawan mo because iniipon niya yung init ng katawan ng sa loob ng katawan natin. Then after that, pag nawala na yung lamig dito sa labas, lalabas na rin yung init. Okay? So next is give liquid paracetamol. Keep within the recommended dose for his age group. Ibuprofen can also be used for a child over 6 months of age. So it is necessary that you need to know that ibuprofen should not be used by an infant lower than 6 months old or younger than 6 months old. Okay? Because ibuprofen are considered NSAID. NSAIDs can what? Or non-steroidal anti-inflammatory drugs can trigger ulceration of the stomach. So, pag 6 months na kasi, nag-i-introduce na tayo ng food sa mga bata. So, at least, nami-minimize na natin yung gastric irritation. Okay? So, keep your child's room at approximately 15 degrees Celsius, 60 degrees or 60 degrees Fahrenheit. So, aircon mo, aircon. Kung wala namang aircon, electric fan. Okay? Wakwakang ba't di tatawa? Okay? Tanggalin yung mga dapat tanggalin para lang lumamig yung kwarto. So, it is also important that you need to know the danger signs. So, call the doctor once if your child is showing one or more of the following symptoms. First, abnormally rapid breathing. Hinihingal. Okay? Kamkamatin na dijay, angis na. Okay? Noisy breathing. Pag huminga, agrarek. Okay? No, kasi mangig mo, dijay, rarek. There is already crushing, a crack. There is, if you will to listen, the crushing of a paper, ganun yung maririnig mo doon sa, without using stethoscope, yung ginagamit natin to hear breath sounds. But, audible so na kahit hindi natin ginagamit itong stethoscope na to. So, please, call the doctor immediately. Okay? Abnormal drowsiness. Turog na turog. Okay? Tulog ng tulog yung bata. So, please, call the doctor. Irritability that is unusual for your baby. Iyak ng iyak. Okay? Hanbut agtalnan. Hindi na siya mapakali. Then, refusing to drink any fluids. So, ayaw niyang uminom. Okay? Ayaw niyang uminom ng there is no appetite doon sa bata. Vomiting that lasts for 6 hours or more. Okay, 6 hours mo tlaangan kat agsarsar walat ta ubing. So, please, call the doctor now because there is a possibility of dehydration. Okay? Ma-dehydrate. There is already an electrolyte imbalances inside the body. Then, a temperature that reaches above 39 degrees Celsius or 100 degrees Fahrenheit, that may lead now to convulsion. Okay? So, I'm done now with fever. So, tomorrow, I'll be giving to you again another topic which is vomiting in babies. But before we proceed on vomiting on babies, I will let you please do your activity. Anong activity? Okay, so first is, number 1 question is, please with the different types of fever, list down at least 2 illnesses or 2 diseases that characterize this fever. Okay? Na ganito yung klase ng fever na meron sila. So, there are 4 types of fever. So, please, I want 2 disease for relapsing, 2 disease for intermittent, 2 disease for remittent, and 2 disease for continuous fever. Aside from that, number 2 is briefly explain to me what is Roseola infantum. Okay? And third is, what is meningitis? Okay? And lastly, number 4 question is, try to interview a mother, okay, and ask them how they bring down temperature of their babies inside their home. Okay? So, interview a mother and ask them how they bring down the temperature of their babies inside their home. Okay? So, write down those your answer in your blue book. Then, take a pic of that. Then, send it to me until Friday. Okay? So, thank you and God bless. Wait again for my another video which will be about vomiting. And there will be 2 now kasi konti lang yung vomiting vomiting and diarrhea in babies. So that we can finish everything until module 2 for the first grading. So good luck, God bless, stay learning while stay safe while learning. So